Let me start with a question. When was the last time you thought about your prostate? If you are like most men over 50, the answer is probably never, or perhaps only when something goes wrong. And that is exactly the problem. Your prostate is a small gland about the size of a walnut sitting right below your bladder. It is one of those parts of your body that you never think about until it starts making itself known. And by the time most men over 50 start noticing symptoms, years of silent damage have already been done. My name is Dr. Chloe, and I am a board-certified urologist with over 10 years of clinical experience working specifically with men over 50 on prostate health and vitality. Today, I want to share with you a specialist's guide to the daily habits that actually protect your prostate. Not complicated routines, not expensive supplements, simple, practical things you can do starting today. Here is what I tell every patient who walks into my clinic. Prostate health is not about one thing. It is about the pattern, the daily choices that compound over months and years into either a healthy prostate or a struggling one. Today, I am going to walk you through the most important daily habits I recommend to every man over 50. These are the same habits I share with my own patients, the habits that actually make a measurable difference. Let us start with the foundation. Habit number 1, hydration. I cannot stress this enough. Prostate health begins with water. Not coffee, not tea, not soda. Water. When you are properly hydrated, your urine is dilute, which means it irritates the lining of your prostate and urinary tract far less than concentrated urine does. Think of it like this. Concentrated urine is like sandpaper on sensitive skin. Dilute urine is like water on water. Most men over 50 are chronically dehydrated. They drink a cup of coffee in the morning, maybe some water at lunch, and then they deliberately limit their fluid intake in the afternoon and evening to avoid waking up at night to use the bathroom. This is exactly backwards. The dehydration caused by this pattern concentrates your urine, which irritates your prostate, which worsens your urinary symptoms, which makes you want to drink less, which concentrates your urine more. It is a vicious cycle. The solution is simple. Drink half your body weight in ounces of water every day. If you weigh 200 pounds, that is 100 ounces of water, roughly 3 liters. Spread it throughout the day, not all at once. And yes, you will wake up to use the bathroom at night. That is actually better than the alternative. A prostate that is properly flushed with dilute urine is a healthier prostate. Habit number 2, movement. Your prostate is deeply connected to circulation, and sitting is one of the worst things you can do for blood flow to the pelvic region. When you sit for extended periods, pressure builds directly on the prostate gland. Blood vessels become compressed. Circulation slows. This creates a perfect environment for congestion, inflammation, and fluid buildup in the prostate. I see this constantly in my practice. Men who work desk jobs in their 50s often have worse prostate symptoms than men who retired from physically active careers. The fix is simple. Stand up every 30 to 45 minutes. Walk for 2 to 3 minutes. Take phone calls standing. Use the stairs instead of the elevator. Park farther from the entrance. These micro movements keep blood flowing to the prostate and dramatically reduce congestion. It is not about going to the gym for 2 hours. It is about not sitting for 8 hours straight. Your prostate needs regular movement like every other part of your body. Habit number 3, nutrition. What you put on your plate every day matters more for prostate health than any supplement you could take. Let me give you the basics. First, add zinc-rich foods. Pumpkin seeds, oysters, grass-fed beef. Zinc is critical for prostate cell function. The prostate contains the highest concentration of zinc in the male body. Every time you ejaculate, you lose zinc. Your body uses it to produce seminal fluid. So regular sexual activity actually depletes your zinc stores. Replacing that zinc through food is essential. Second, eat cooked tomatoes with a little healthy fat. Tomatoes contain lycopene, a powerful antioxidant that concentrates in prostate tissue. But lycopene is fat-soluble, meaning your body absorbs it better when tomatoes are cooked and eaten with a small amount of olive oil or avocado. A tablespoon of tomato paste in your morning omelet with a drizzle of olive oil is one of the simplest prostate protective meals you can eat. Third, choose anti-inflammatory foods. Fatty fish like salmon and mackerel provide omega-3 fatty acids that reduce inflammation throughout the body, including in the prostate. Green tea contains catechins that calm prostate tissue. Berries are low in sugar and high in antioxidants that protect the vascular system. And fourth, pull back on the inflammatory foods. Processed red meat, full-fat dairy, refined carbohydrates, and excessive alcohol all contribute to systemic inflammation that feeds prostate problems. You do not need to eliminate these entirely, but if they make up the majority of your diet, your prostate is paying a price. Habit number 4, sexual health. This is one most men over 50 either avoid or feel awkward discussing. But as a medical professional, I need you to understand something. Regular ejaculation is one of the best things you can do for your prostate health. Here's the biology. During ejaculation, the prostate produces and releases seminal fluid. This is the gland's natural function. When men avoid ejaculation for extended periods, the prostate fluid stagnates. It becomes thicker, more concentrated, and prone to congestion. Think of it like a river. A river that stops flowing becomes stagnant. A river that flows regularly stays clear. Research published in the Journal of the American Medical Association found that men who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer compared to men who ejaculated only 4 to 7 times per month. That is a significant difference. Now, I understand that sexual function can change after 50. Performance is not always what it was at 30. But here's what I tell my patients. Whatever your current level of sexual activity is, maintain it. Do not withdraw from intimacy entirely because things have changed. If you are experiencing erectile difficulties, talk to your doctor. There are solutions that work. And if you are single, even regular ejaculation through other means has proven benefits for prostate health. Your prostate needs regular release. This is not optional. This is biology. Habit number 5, sleep. Sleep is when your body repairs itself, and your prostate is no exception. Poor sleep raises cortisol, which increases inflammation throughout the body. Elevated cortisol also disrupts hormone balance, including testosterone production, which directly affects prostate health. Most men over 50 do not sleep well. They wake up once or twice to use the bathroom. They have trouble falling back asleep. They wake up feeling tired even after 8 hours in bed. This is often dismissed as normal aging. It is not. Sleep apnea in particular is severely underdiagnosed in men over 50 and has a direct impact on prostate health. If you snore heavily, wake up gasping, or feel unrefreshed despite adequate sleep time, talk to your doctor about a sleep study. Treating sleep apnea can significantly improve prostate symptoms and overall vitality. For better sleep, establish a consistent bedtime even on weekends. Keep your bedroom cool, dark, and quiet. Put your phone down at least an hour before bed. Limit caffeine after early afternoon. These are not complicated changes, but they compound powerfully over time. Habit number 6, stress management. Chronic stress is one of the most damaging things for prostate health, and most men completely underestimate it. When stress becomes your background noise, not a moment of pressure, but a constant hum that never switches off, the hormone cortisol floods your system. Short bursts of cortisol are protective. Long-term cortisol is corrosive. It weakens your immune system, tightens blood vessels, raises blood sugar, and disrupts hormone balance. It also worsens sleep, which creates a cascade of other problems. I see this constantly in my practice. Men who are under sustained high stress often have worse prostate symptoms than men with similar physical health profiles who manage stress better. The fix does not require you to eliminate all stress from your life. It requires you to build outlets. A genuine walk in the morning, an honest conversation with someone you trust, an hour doing something that actually brings you joy. These are not luxuries. They are medicine for your prostate. Habit number 7, screening. This is the one most men skip, and it is costing lives. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. But when caught early, the 5-year survival rate is over 99%. The problem is that early prostate cancer has virtually no symptoms. By the time symptoms appear, the cancer may have spread. A simple PSA blood test can detect prostate changes early. Combined with a digital rectal exam, this is your best defense. I recommend baseline screening at 50 for average-risk men, at 45 if you have family history, at 40 if your father or brother had prostate cancer. This takes 20 minutes that could add years to your life. Please do not be the man who comes to my office with advanced prostate cancer when we could have caught it years earlier. This is not optional. This is survival. Let me bring this all together. Today we covered 7 daily habits that protect your prostate health. Hydration, because dilute urine is medicine for your prostate. Movement, because circulation is critical for prostate function. Nutrition, because what you eat every day compounds into your prostate health or prostate problems. Sexual health, because regular release is protective, not harmful. Sleep, because repair happens at night. Stress management, because cortisol is corrosive to prostate tissue. And screening, because early detection saves lives. Here is the powerful truth. You cannot control your age. You cannot erase decades of past choices. But you can start today. Every single day you make a different choice is a day your prostate gets a chance to heal and function better. These habits are not complicated. They are not expensive. They are simple daily decisions that compound into years of prostate comfort and confidence. Drink your water. Move your body. Eat real food. Maintain your sexual health. Sleep well. Manage your stress. Get screened. Your prostate health is in your hands, literally. If this video helped you, hit that like button. It helps Dr. Chloe Wellness reach more men who are taking their health seriously. And subscribe to this channel. Every week, I share practical, science-backed insights specifically for men over 50 who want to understand their bodies and protect their health as they age. Drop a comment below. Tell me which of these habits you are going to focus on first. I read every single one. And share this video with a man in your life who needs to hear this. Your father, your brother, your best friend. Prostate health is not a topic men talk about openly enough. Let us change that. Until next time, take care of yourself. Your prostate is counting on you. This is Dr. Chloe. Stay healthy, gentlemen.